Hi there. So, what a delight it is to see you. Thank you so much for joining me for this remote fireside chat. Your time as CEO of Takeda Pharmaceutical coincides with my years in my most recent years in Japan as a Financial Times correspondent, and most of those years the conversation has been about governance and improving governance. And I know that your company, with you as its leader, has been right at the center of that. But now suddenly we have the pandemic and the responses that must take and have taken a priority. The pandemic has, of course, produced a number of responses from industry and from governments, with which the world can be both proud and, in some cases, a little disappointed. I guess my first question to you, Christophe, is where would you place the global pharmaceutical industry between those two poles, and in particular the Asian region that we're both sitting in?
Yes, I mean, I think the pharmaceutical industry has responded very rapidly to the challenge, and it's a reminder that this is what we do. We develop medicines and vaccines to treat healthcare disease and challenges. So I think it was fascinating to see how quickly the industry reacted to develop vaccines and medicines. And we have seen a level of collaboration never seen before. So I think that it has been great to see how the industry has reacted. Now, having said that, we could have been prepared better because we knew 5-10 years ago that there was a pandemic risk, and everybody could have been prepared better, the government and the industry. And I think this is a learning we should not forget, because when we will have resolved the COVID-19 crisis, I'm optimistic that we will have to not forget the lesson and start preparing for the next one. And I know it's a bit premature to talk about that, but we should not forget that.
I'm wondering, I mean, one of the lines that I remember hearing in the early days of the pandemic, and particularly when we were looking at the responses of countries like China and elsewhere in the Asian region, we kept hearing about the kind of institutional memory of SARS, which obviously hit in the early 2000s and did present those countries, particularly with very harsh lessons. Did you feel that? Did you agree with the idea that SARS had been remembered as a set of lessons to both the industry and to governments?
I think these countries remember how they managed SARS, and certainly it has been part of the experience of Asian countries. When I compared how countries have reacted, I am today in Tokyo, and life in Tokyo is almost back to normal here. And I just flew back 2 weeks ago from the United States, and it's a very different perspective. And if I compare how the countries have managed the situation, it's not on the confinement that you see a difference, because everybody is doing confinement the same way because you lock down everything. I think it's more in the way countries have managed a reopening. And what we have seen is that countries which are managing the reopening too loosely are facing very rapidly a second wave or a spike. And I think this is, for me, the learning is not how you confine, is how you reopen, and how careful you are to reopen, so that you manage the level of contamination when you reopen.
I wonder if, just to stick with that, and at a sort of a more immediate example, you yourself are running a global company. You've got staff in many different countries where the rules are different, where the protocols on reopening economies have been very different. Just give us a guide. As a company, how have you handled the reopening, or how have you handled the continuation of business under those very different national conditions?
Well, we have our own funny global protocol. So, for example, even if a country is reopening, we enforce physical distancing. We limit the density of employees in our office, and we are very strict with sanitization, for example. So even if we are operating in a country which is less strict, we have our own protocol. We are fortunate at Takeda to have very strong experts in epidemiology, in pandemic management. So we were very reactive. So we started our own protocol back in January when we saw the first cases in China emerging. And so we are also, having our own way of managing the situation.
I wanted just to pick up on something you mentioned earlier to do with the this huge level of cooperation that we have seen, that we certainly saw revving up very quickly in the early months of the pandemic going global. Can you give me an idea of how as a CEO of a company right at the heart of that cooperation, you went about ensuring that the cooperation took place? I mean, were you surprised at how comfortably you were able to cooperate with business rivals around the world? And also, how sustainable is that cooperation?
So at Takeda, cooperation and partnership is at the core of the way we operate. We have about 200 R&D partnership running, and they were existing before the COVID-19. So our immediate reflex was a cooperation reflex. I'll give you an example in the field of plasma-derived therapy. We are developing an hyperimmune globulin, which hopefully will be very helpful to treat hospitalized patients. And for the first time, we have a global alliance with all the companies involved in the plasma-derived therapy business came together to pool resource and to develop one product which will be the proof of concept for everyone instead of everyone working separately. That has never been done before. And once the COVID-19 crisis will be over, I think this type of alliance will dissolve. But we have learned a great deal how to do it, and will be even faster next time if there is a need. In other areas, I think some cooperation will stay. For example, we are involved in an R&D alliance to share data, information. We have created a knowledge platform so that we don't recreate everything in our own company. I mean, this type of pre-competitive cooperation could stay in the future.
Do you think that, a big part of that cooperation has been the belief that governments around the world were in full support, not just emotional support, shall we say, but also ultimately in financial support of that cooperation and of those ongoing efforts? Do you think that belief is still as strong now in the industry as it was 6 months ago?
Well, yeah, I think it is still very strong because we still have to bring the vaccines and the treatment. We are not done yet, and we still have to go all the way. And so everybody is very committed to that. I think the key, the government has stepped in, but I think what has been the key success factor here has been the ability to have a different type of dialogue with regulatory agencies in order to share information and speed up the process to find a way for approval. Usually it's always a very long process to discuss with regulatory agencies about what should be done to prove that you are efficacious, for example, and that has been completely shortened to an extent which is mind-blowing, frankly. And I think that has been really what has allowed the acceleration of the vaccines and the medicine development.
I mean, since you mentioned vaccines, obviously for the last 24 hours or so, vaccines and the prospect of effective vaccines have been a very big news story, and obviously a lot of the euphoria that we've seen in the stock exchanges last night and today has to some extent been based on the idea that maybe we really are on the cusp of something very exciting. I mean, the question I have is has the world changed over the last 24 hours from your perspective? And I guess the follow-up to that would be, what would need to happen for the world to change from your perspective?
Well, I think that we are still fighting against a never seen before crisis, health crisis, economic crisis. So we still need to get out of that. And so whatever any election result we have in the world, we should focus on that. And again, it's not over, far from it. And we still need to go all along. I'm optimistic that the vaccines will be efficacious. We have never seen so many vaccines developed against one single disease in the history of humanity. We have so many vaccines in development, but more importantly, we are using different type of technology to develop these vaccines. That's very unique, and so I'm very optimistic that a few vaccines will be successful. But we will need to be very careful, and that's something I take the opportunity to share with the audience. We need to be very careful about how we will do the vaccination, how we will vaccinate people, what type of information we will share with the people about the vaccines, and also prepare the population about the vaccination, because we will do a vaccination at a scale never done before, and that has some very specific challenge which could derail the vaccination by itself. So we need to be very careful about that.
But also at the same time, it sounds like you're saying we're not going to take our foot off the pedal on the therapy side as well.
Absolutely. I think no vaccines will be fully efficacious. There doesn't. The best vaccines usually they have 90% efficacy, 95, so it's never 100. We don't know where we will end up with these vaccines. It could be 70%, it could be 60, could be 80. So that means that you could have 30% of the people vaccinated not protected. This is the type of information that we will have to share very carefully. And the efficacy might wane over time as well. So you could be protected at the beginning, but 18 months later, you might have a lower protection provided by the vaccine. So we'll still need good treatment.
And that sort of brings me to my next question, Christophe, which is, that the fact that you mentioned the plasma therapy earlier. The fact that you're discussing that is the result of a huge merger that your company achieved a couple of years ago, and that that has transformed the Japanese company that was Takeda into a completely global company. And I guess you're near the end of the integration process now. What have been the big challenges of that, irrespective, I guess we'd say, of the pandemic?
Sorry, I missed the beginning of your question, but I got the end, so I'll still jump. I think we were very, in a way, we have been very fortunate, because we finalized the integration of the two companies by December 2019. So by December we are a very different company. We have 50,000 employees across the world. We have one of the 10 largest pharmaceutical company. But our true values and what we are focusing on, which is to discover and deliver life-transforming medicines, is still there. So even though we have changed in scale and in size, we are still very much focusing on why we exist, which is to discover life-transforming medicine and vaccines.
One of the ideas that has come up again and again. You are the CEO of a non-Japanese CEO of a Japan headquartered company. There have been some other very high profile people who have filled similar positions, and a lot of what they have sort of spoken about in interviews has been this idea of bridging very different cultures across a large organization like that. And I've often wondered whether that is the right way of thinking about it. I mean, do you see your role as CEO as something as bridging cultures, or is it something more sophisticated than that?
Well, again, Takeda is a very truly global company. So we have 50,000 employees across the world. 20,000 out of these 50 are in the United States. So, what is important is to be truly diverse and have a very clear strategy and clear values. So we are a truly diverse company. If you look at the executive team of Takeda, my executive team, there are 11 nationalities in this executive team. And this executive team is based both in Japan, in Boston, and in Zurich. So it's a truly diverse international executive team. But there are some specificities linked to where you are and where you come from. Takeda is almost next year will be a 240 years old company. So we have been around for a while. And I think one of the specificity of Japanese company, and certainly Takeda, is that stakeholder capitalism is not new to us. This has always been part of the philosophy of capitalism in Japan, and I think it's a very good position to be in right now globally. Now, of course, we want to be very performant as well. We want to be very competitive. One is not against the other, but there are some specificities like that you can leverage to be even a stronger global company.
And I began this by saying, talking about, the history of corporate governance reform in Japan and corporate progress on corporate governance. I mean, how important has that part of things been to integrating a company of this size? I mean, has the governance side of things been your priority as a CEO?
Very much my priority, and our governance is still quite unique. I believe in Japan. You look at the Takeda board; there are the vast majority are independent director, which seems normal outside of Japan, but not necessarily in Japan. The chairman of the board is an independent director. We have independent nomination committee, compensation committee, audit and supervisory committee. So I think our governance is very different. It fits still well the Japanese context, but it also match international standards. And I think this is what we have been aiming to do, and that has been very helpful to integrate the two companies. We also got listed on the New York Stock Exchange, which also require a very strong governance. So yes, it has been a very key and very high priority.
And sometimes, over the last few months, we've heard, in the context of the the economic threats that people have talked about, along with some of the geopolitical threats. We've heard companies talking about deglobalization. Have you, how worried are you about that being a factor in your company's future?
Well, that's something we are watching very closely because in our industry, usually we have one or two sites producing one medicine for the world. And so we are ultimately extremely global in our supply. So if there will be any very strong separation or bifurcation, we'll need to revisit the way our supply chain will have to be designed. And that will come with a very significant incremental cost. So far at Takeda, we have not taken very strategic decision on that. We are not dependent on any country to produce our medicine, so that's a good place to be in. But this is something for of course to watch and to monitor closely.
Christophe, I'm afraid I think we're running out of time, but I've got just time to ask you if you can throw your mind back to March this year, where the world really did seem a very pessimistic place, and compare what you felt then with what you foresee now for the end of this fascinating year. How would you characterize your outlook now?
Well, I am optimistic, but not for necessarily the end of this year. I am more optimistic for next year. I think that's my guess. By next summer, we will have vaccines, and we will, many countries will start vaccinating their population. At the same time, treatments are also getting better and better. So, I think that by the second half of next year, we will really start to see a good management of the crisis. And I hope that by the end of next year, we'll be in most countries in a back to normal situation. That's now it seems perhaps a bit pessimistic in terms of timeline, but that's what I believe is the most realistic based on what I can see. We are involved in vaccines, in treatment, in hyperimmune globulin. So Takeda is involved in all the solutions that are under development right now. So this is what I see coming in the next year or so.
Well, I think that if there's one thing that one quality that we all look for in the CEO of a global pharmaceutical company, it's realism. So I think that's probably a better answer than the overly optimistic one. So thank you very, very much indeed for that, and thank you very much indeed for joining me today. It's absolutely fascinating to hear from you and to compare notes on what has been a strange pandemic, particularly for Tokyo, where at the beginning we really thought it was going to be a repeat of what happened with SARS and so on, but actually Japan has managed it reasonably well.
Yeah, so far so good, and hopefully it will stay like that. But I would like to express my support to all other countries which are struggling more at the present time. Things will get better.
Yes. Thank you again. Thank you very, very much indeed. It's been wonderful talking to you. And we're always grateful at the Financial Times for the input from Takeda Pharmaceutical.
Thank you very much.